Okay.
Talk to me. Thank you, Ali. Greetings, Bulawayo. Greetings, Zimbabwe. Greetings to our family in the diaspora. My name is Professor Lindiwe Majele Sibanda. I'm the Deputy Chair of the I Am for Bulawayo Fighting COVID-19 Trust. I Am for Bulawayo Fighting COVID-19 is a people's initiative. It's a movement that is making sure that as Bulawayo, we are ready to fight COVID-19. We want to make sure our health facilities are well equipped. We want to make sure that the general public is informed about how to adapt to the new normal. It's been abnormal. We have lost some souls. Some people have succumbed, but we keep fighting on. Sithi noma kanjani Bulawayo sizanqoba. Today, we have the National University of Science and Technology team that's going to demystify science. They've been hands-on in combating COVID-19, and we are honored to have with us 3 excellent representatives of the institution. I am happy to introduce to you Professor Nkosikhona Hlabangana. Professor Hlabangana is the current director at the Research and Internationalization Office at NUST. He's a seasoned engineer, having handled different projects in engineering that are dealing with water treatment, mineral processing, and process synthesis. He has contributed to various fields through writing journal articles, reviewing manuscripts, dissertations, and reports. He's going to unpack and demystify the science of engineering in COVID-19. I also have Mr. Zephaniah Dlamini. He's the Director of Applied Genetic Testing Center and Senior Lecturer in Molecular and Genetics and Biotechnology, Department of Applied Biology and Biochemistry at NUST. He holds a BSc Agriculture Honors Degree in Crop Science and a Master's Degree in Biotechnology from the University of Zimbabwe. After training in DNA fingerprinting as a student research intern at the University of Wisconsin-Madison in the United States of America. This is where he did his research project for his master's degree. He has international working experience as an associate professional officer responsible for biotechnology adoption and commercialization in developing countries at the FAO Food and Agriculture Organization of the United Nations in Rome, in Italy. He has also worked as a consultant in molecular biotechnology at the IAEA, the International Atomic Energy Agency in Vienna, Austria. My third panelist, who will soon be joining us, is Mr. Alec Ncube. He's the acting director of the National University of Science and Technology Innovation Hub. Mr. Ncube holds qualifications in intellectual property as an intellectual property educator, media and information science expert. He's also a commissioner on the Zimbabwe Media Commission. Currently, he is a student, a doctoral student at the University of Cape Town, majoring in commercial law. Thank you to my panelists for their time. And without further ado, I would really like to find out, after those heavy accolades that I've shared about your professions, if I were your daughter, Professor Hlabangana, what do you do?
Thank you very much, Prof. Sibanda. And I would like to greet the viewers. Ngithi siyathaba ukuba lapha Bulawayo omuhle. And I hope by the end of this session would obviously have demystified the issue of COVID-19. I am Professor Hlabangana under the Office of Research and Internationalization. The office used to be Research and Innovation. And then of late, the Pro-Vice Chancellor, was Professor Nick, decided to obviously increase the portfolio of this particular office. He had been a director for a number of years, and having that experience, he decided to increase the portfolio and include the internationalization aspect. Why internationalization? It is because we want to put through the name of NUST out there international. We want NUST to be a recognized brand. Apart from NUST being an innovation institution, remember NUST deals with science, technology, and mathematics. We are a STEM institution. And therefore, for us to be recognized out there, we need to go international. And then that's why the issue of internationalization was introduced. Okay, what is this internationalization? First and foremost, a university that does not collaborate, a university that does not do interdisciplinary research is a dead university. For example, I might have a specialist in biochemistry, that specialist being in the University of South Africa or be in the University of Birmingham. Chances are, if I am to work and have profound or true knowledge, I need to collaborate such that I gain more as a researcher. And apart from that, we've got quite a lot of mobility grants whereby our students, our academics, and our staff members, they move to universities like Uppsala under the Erasmus Fund. We also have the DAT, that is the German funding, whereby our students also they collaborate with institutions in Germany and also in South Africa. So all this, the main aim being to put the name of NUST out there in the field.
Professor Shabangana, ngingumntanakho, I'm 7 years old. Daddy, what do you do?
Yes.
30 seconds.
My day-to-day activities are to do with research. So first and foremost, I need to ensure that NUST does research. For example, we've been doing sanitizers. These sanitizers that are being used by the public, I need to ensure that the sanitizers that are distributed to the public, they adhere to the WHO standards. Otherwise, them being used and not adhering to the standards, they become useless.
So, Daddy, what is research?
Oh, okay. Research is all about getting more and more information so that we can develop.
Thank you. Over to you, Mr. Zephaniah Dlamini. What do you do at NUST? Please unmute yourself and stay on unmute.
Thank you, Professor Majele-Sibanda. At NUST, I teach science. I teach genetics and biotechnology. And I practice science in offering services to the community, mainly identifying people and using DNA and, telling people if they are related or not.
Thank you. Science, genetics, biotechnology. I'm keen on those last two. What is biotechnology? What is genetics? Just unpack that so that I understand what you do.
Okay. Biotechnology is the use of living organisms or their parts to deliver services and goods and products. So if you are using any living organism to derive a product, that's biotechnology. So
give me an example of a living organism that you're talking about.
An example of a living organism is a bacteria. You can have bacteria, yeast. Those are living organisms. The moment you are using those microorganisms to process, say, milk to yogurt, that's biotechnology.
Excellent. What about genetics?
Genetics. Genetics is the study of heredity. Heredity being, how individuals or organisms are related.
Thank you. Thank you very much. So biotechnology, genetics, and science, we can now relate to the viruses, to the bacteria. That's your core business. We'll come back to you to understand how you've made a life of living with things we are all afraid of. Baba Ncube, Mr. Ncube, you are in the hub. You wake up every day going to work. I'm your 7-year-old daughter. Tell me, what do you do in the Innovation Hub?
Thank you, Prof. I want to start by saying the NUST Innovation Hub is a latest creation by the Ministry of Higher and Tertiary Education, Science, Technology, and Innovation Development, where they are looking at universities playing a role in terms of the industrialization of the country, or leading to a knowledge-based economy for Zimbabwe. So at the Innovation Hub, our major task is to ensure that the research which takes place within the faculties of the university is transformed into goods, products, and services. And this is what Professor Shabangana does in terms of spearheading research and development. But for us at the Innovation Hub, we then look at the research which we can then convert into goods, products, and services, which can then transform the lives of the community out there. So every day I go to work, my wish is to hear from various faculties to say, we have got this innovation. Can we assess it? How can we take this to the market? Because I think that's where our education system has been lacking in terms of how we take research to the market. So it's from the lab to the Innovation Hub to the market.
Teddy, what is innovation?
Okay, innovation is coming up with new ways, let me put it, of doing things, or coming up with adapting whatever probably has been invented elsewhere, and making sure that it can be converted into a useful product or service. So it's a multifaceted term in terms of what innovation really it is. But what I can say is it's taking research and development into something which can then be converted for commercial use.
Thank you. To my listeners and audience, I am trying to demystify science and trying to break the jargon from our scientists to everyday language that we can all relate to. Let me come back to you, Professor Shabangan. As a university, we are facing this big pandemic, COVID-19. To what extent have you been involved? Has the university been engaged? If so, can you unpack for us how, as an institution, you've positioned yourself to solve societal problems?
Thank you very much, Prof. Sibanda. The University of Science and Technology has done tremendously well in terms of research. Remember, research is about getting information, new information, and applying it. The reason why I want to research is because I can see there is a gap, and that gap affects the society. And then I want to fill that gap with the new information that I would have obtained. Now, the gap that we discovered was that in terms of the production of those COVID mitigation products, we had a challenge. We needed some products that will obviously be effective. And then that's where the research aspects came in. So in terms of research, we are saying we have the product, which is the sanitizer, which is our PPE, which is the mask that our brothers and sisters wear out there as they go, as they undergo their day-to-day activities. What can I do to ensure that they are safe? Then we decided to take that sanitizer to the lab. In other words, what I need to do is I need to do some interdisciplinary research. Now, an engineer will come in and say, I want to do a plant that will obviously do the production. So we'll take an engineer, say, design that plant. And then a chemist or a biochemist will say, I am coming in to do the test. As you produce, I don't want to send a product to the community that is ineffective. So I need to test the raw material that is coming in. I need to test each and every product that is produced at each particular point, such that at the end of the day, I get a good product. So that is exactly not what NUST has been doing. And at the end of the day—
Can you give me specifics on the products and what you have done as NUST? You've highlighted research. You've highlighted the role of your engineer, your chemist. What are the tangibles I can touch and say, this is what your office has been coordinating?
Okay. As the leader of the sanitizer and the disinfectant production, as a research director, I was able to take that product and then liaise with the chemist and the biochemist, who will obviously do some further tests on the product to ensure that it doesn't contain any impurities that might affect the people out there in our society. So they take the product, take it to the lab. It's a sanitizer. They took it to the lab. They did some tests to say, what are the impurities that are present? Right, we don't need those tiny microorganisms that affect us or that makes us get sick. We don't need impurities like dust particles that might render the sanitizer ineffective. Therefore, they do all those tests, and then at the end of the day, I am able to rubber stamp and say, this product is good. But before I did that, I had to take it to SARS.
Okay.
And then SARS, what they simply do is they do further tests to ensure that the product qualifies in terms of its standards. And then once they agree, or they rubber stamp the product also, they say they will always tell us that you can proceed with your procedures to say your product is good, it can be sent to the market, it is safe for people to use.
Thank you very much. So let me just walk you backwards so that we are very clear. You've got product A is a sanitizer. You are worried about the safety of the product. You carry out the investigations to make sure that there are no impurities that can injure my health. When you've done that, you take it for certification to SARS. What is SARS and who is SARS and what do they do for the university, that which you cannot do for yourself?
Okay, thank you very much. That is a very vital question, because out there it's so sad. When you go out there in our communities, people tend to use sanitizers that they make at home without any test. I remember getting into a shop, and somebody was just sanitizing someone using a sanitizer that was made out of spirit, and they just added a little bit of some other chemicals. So, in other words, as I come in as a buyer into that shop, I am sanitized thinking that this is a good product. But at the same time, I am put under a threat. In other words, chances are that sanitizer won't even work, and then I'm at risk of getting COVID-19. So now, it is very important that we have a standard body that satisfies our product. For example, if you look at the milk that you drink, obviously there is a logo that's written SARS. If you look at most of the products, there is a logo that's written SARS. It gives me confidence as a consumer to use that particular product, because I am saying there is
So who is Mr. SARS? Who is Mrs. SARS?
I'm going there. SARS is the Standards Association of Zimbabwe. In other words, they come in to say, we've got a standard of producing a product. If that kind of product that you've made does not match with our standard, then it has failed.
So what you're raising here is a situation where we are going into all these shops, people are sanitizing us. How, as a layperson, would I know whether this is real sanitization or it's fake? Is there a way that the SARS certificate is dangled, or is there a way that ordinary citizens can know that products are SARS certified?
That is a very difficult question, because in most cases, for a product that has been bought from a manufacturer that subscribes to SARS, then they will obviously have a logo. If you look at the NUST product, if you look at the UZ product, if you look at the HIT product, they've got that SARS logo to say this has been certified. But in most cases, we've seen these SMEs that mushroom all around us. They just make that sanitizer, and then they supply these small to medium shops, and then obviously we are at risk. So it is very difficult, very, very difficult to obviously identify that this is a product that is of good standard. But the most important thing is, in most cases, we advise communities to carry their own product that has been SARS certified. So if I'm going to TM Hyper, I need to carry my own a small container of a SARS sanitizer, a sanitizer product that has been SARS certified, that I can spray continuously to ensure that I'm safe.
I really love that advice, Professor Hlabang, and I think we've all taken it that it's the law that someone sprays or sanitizes me, but what you are raising is you don't know what's in that sanitizer. Make sure you have double protection. Comply, but have your own kitty that has been bought with a SARS stamp. Over to you, Mr. Ncube. You are running the Innovation Hub. Are you selling these sanitizers? Can Bulawayo come to you and get access to sanitizers? And what else are you selling and producing in your Innovation Hub? Over to you, Baba Ncube.
Thank you very much, Prof. And I want to reiterate what Professor Hlabang said again in terms of the products being, certified. As the Innovation Hub, we ensured that our products meet the standards which are set by the Standards Association of Zimbabwe. And again, when we look at the advent of COVID, it's a disease, and if it's a disease or an infection, people tend to be wary about a lot of things. So when we chose the route of going to SARS, it was all because we wanted, to assure the public that our product meets the International World Health Organization standards. We are, as NUST Innovation Hub, selling the sanitizer and as well as the face masks, which we are producing, and we have actually set up a plant on the NUST campus to produce, the sanitizer. I want to talk about, the issue of, certification. I want to talk more about that. It's very critical because it also goes hand in hand with the issue of intellectual property, which the Innovation Hub has a mandate to actually, look after the university intellectual property. We did not only get, a SARS, certification for our sanitizer. We actually got a brand, a trademark. We are calling it the NUSTizer, so that one can separate it from other brands of sanitizer which are out there on the market. So it's all critical for people to understand that the various products on the shelves where they buy their products, they need to be assured that this is really the real thing, because we are talking of something which is what implications on your health, which as the NUST Innovation Hub we were wary about. We actually came up with a trademark which we are calling NUSTizer, and we got a standard again from the Standards Association of Zimbabwe. So we are producing.
I'm really impressed. So NUST is into business now. We heard from Professor Hlabang and the different disciplines that are involved in the process, the engineers, the chemists, to make sure that you have a safe product. You've gone ahead to make sure that it is certified by the Standards Association of Zimbabwe, but also gone ahead to brand it so that you have the intellectual property rights certification that NUST has a branded product that if I go to the market, it is there. Two questions for you. My grandmother jumped onto this bandwagon and got her Singer sewing machine, and she's been churning out these masks, and at the local school, people are buying what is the difference between what she's producing and what NUST, and how does an ordinary eye get to see? What should we look out for? And my second question is, you are in a public institution, you're in the business of producing students. Are they benefiting in any way from the sale of products? And this question has popped up in our Facebook page from Tony Briggs. Can you just enlighten us on those two issues?
Thank you very much, Prof. I think it is important to note that, yes, we know when the outbreak, after the outbreak of, COVID, a lot of, SMEs and a lot of, grandmothers, like you say, started producing, these face masks. I want to emphasize that there is an international standard for face masks, and there is one standard which is called the UNTITLed standard for the production of, face masks, which meet at least, some international standard in terms of protecting, their users from the COVID. If you look at our mask from NUST, it's a three-layered face mask, which meets that international UNTITLed standard for, face masks, so that it becomes a layer too. The virus cannot, go through that three-layer face mask. So for us as NUST, I think that separates us from the ordinary, face mask, which people can just take a piece of, cotton cloth and just make. Ours means that the UNTITLed standard of having three layers, at least to protect, those who put on those masks.
Can I just get from the three of you gentlemen, I'll go to Tony Briggs' question. If I wear a one-layer handkerchief versus the NUST three-layered mask, what happens?
Thank you, Prof. You are not, in short, you won't be fully protected, which means the barrier which you will be putting on your mouth, the covering which you will be putting onto your, mouth and nose, won't be really effective against, protecting you from, getting an infection, because it's not really effective. It's just a single layer which offers little protection, if I can.
So what you're saying is, as I have my handkerchief over my face and over my nose and mouth, the virus is penetrating and going in?
Yes, that's possible, because it's just a single layer, which, that's why for the NUST one is three layers, so that at least you get protection from the first layer, second layer. And it was actually proven that, a three-layered face mask is more effective than, just a single layer, face mask.
So what is the science in this layer? Is that any cloth like my handkerchief, or there's a specific type of material in the layering that should be used? What is NUST using?
Thank you very much, Prof, for that. It's a very pertinent question. There is a filter which is actually put inside, the face mask, so that it becomes even more effective. So there are different types of, material which are used. And then there's a filter now which is put in the middle to make it even more effective.
Thank you. Thank you for educating us on that. We thought handkerchief goes, chitenge goes, as long as you have something, the police won't arrest you. But it's clear there is a science behind masking. And unless you adhere to that science, you are exposed. Can we go to Tony Briggs' question? Are students benefiting from the sale or production of sanitizers, these masks that the Innovation Hub is rolling out?
Thank you very much for that question. Yes, students are benefiting. I can actually state that we are using students in the production of some of these products which we are marketing as a NUST Innovation Hub. When I'm saying we are using students from the faculties, like I would point out to the faculty of, say, industrial engineering. There is a department there of chemical engineering. The students who are making the sanitizer are actually part of, the students in that faculty. And we also got students from the faculty of applied chemistry, applied sciences. They are also involved in the production. So in that production, they are getting something. So in fact, instead of them going out to industry, we are now, showcasing their talent within the university. They are benefiting. And we are hoping that from the process of these sales, we can improve the services or the facilities at the university through, the profits which we will make from producing these to probably buy more laboratory equipment, buy more chemicals for them to, undertake their research and development.
Baba Ncube, you use the words we are using students. When I'm used, I don't see the benefits. Can you unpack that benefit part? If your students are participating and you're saying you are using them, how are they benefiting?
Yeah, the students are benefiting in two ways. Let me put it this way. One, they are getting to learn from their supervisors who are experts, who are expert researchers from the university. The second benefit is that they are getting some monetary rewards in terms of their participation.
Excellent. Thank you so much. Tony Briggs, I'm sure you're answered. I'd like to move now to Mr. Zephaniah Dlamini. You unpacked for us genetics, biotechnology, and genetic mapping and printing. How have you been involved in the COVID-19 fight?
Thank you, Prof. As mentioned earlier, we are running at NUST a DNA testing center. This DNA testing center has staff and equipment that is used to test any nucleic acids. As we know, the COVID-19 is a virus and its genetic makeup is what we call RNA. So to test for the presence of this COVID-19 virus, you use molecular genetics tools. And one of the processes is called the polymerase chain reaction, or PCR. So there were a few PCR labs in the country. And our lab was approached by government, and we were asked and instructed to assist the country in testing for this virus using our equipment. And we covered 5 provinces, that is Masvingo, Midlands, North, Matabeleland South, and Bulawayo. So we were testing for people for COVID from these provinces. And we moved our equipment to a biosecure place at the National TB laboratory at Mpilo Hospital. So we were doing the testing, and NUST staff helped train a lot of technicians there at the National TB Reference Lab. And we did the testing during the first wave from April up to November. Mm-hmm. Then we said, no, look, the government bought a number of PCR machines, so the labs were now equipped, and we trained staff as universities people. We make a living by teaching people, isn't it? Mm-hmm. So we taught a number of technicians on how to do these tests. And then we said, no, let us go back to the university and do other exercises with regard to this COVID, because all the kits for testing are being imported. They are still being imported. So we said, no, we will, let us go into the manufacturing process. So we did some research, and we are now in the process of commencing production of PCR test kits for COVID and other diseases. So with the support from the Ministry of Higher and Tertiary Education, we are going to be buying, we're in the process of procuring a DNA synthesizer, which is a machine which synthesizes DNA, or what we call PCR primers, oligos, which we use to test for for COVID. So we hope we'll soon be doing that. Plans are on course, and the purchasing process has commenced. So we'll start as soon as the machines come. We'll start doing PCR kits and even virus transport media. It's sad. I mean, we are importing virus transport media. You know, after you've been taken a nasal swab, the swab has to be put in some container with a certain liquid. We know the formula from biochemistry. Why not make it here? So we'll soon be making that as well.
Amazing. Thank you so much, Mr. Dlamini. I mean, 3 things I pick up. You were right in the forefront as of April last year in testing people for the virus. This was before it was mandatory. This was all government driven. You took your own machine to Pilo Hospital facility where you have the biosecure place, and you trained staff on how to do the testing. And this testing was not just for Bulawayo. You covered Midlands, Maswingo, Mat South and North and Bulawayo province to make sure that we can keep a count on the number of infected people. So congratulations, NUST, for being in the forefront. And these are the untold success stories of NUST doing community service and solving societal problems. But I'm more intrigued by the future. I mean, you have not stopped at testing. You are now looking at the facilities for testing. Yes, you've got the PCR machine, you had it for your own DNA test, but now you are saying, look, what are the ingredients that are critical? What are we importing? What is it that we should be thinking and extending our minds to produce locally to conserve our foreign currency, which can then be diverted into other things? Very excited to hear about the plans for the test kits, for PCR test kits that you'll be producing, and the new machine that you're importing. What does that mean in terms of business for NUST? Well, what are your projections?
Oh, the numbers look exciting on paper. For instance, the virus transport media, I think the capacity we are building is that we can produce 50,000 vials a week.
And what's the cost of a vial?
Probably $3.
Make it $1 and you tell me you are producing 50,000 US dollars a week. I want to belong to NUST. Yeah. All right. So well done. Congratulations. And I think when we talk Innovation Fund, Education 5.0, those are the sort of things our minister had in mind. And I just want to come back to you, Mr. Ncube. I'll come back to you, Dlamini, again. You started off by saying all this is in line with Innovation Education 5.0. Can you just, in a snapshot, open that world to us? What is that about?
Thank you very much, Prof. I think we need to, as you know, Zimbabweans understand that there's been a lot of talk of, Zimbabwe having educated people, but not producing anything in terms of out of their education, nothing to show. So government then saw it fit to say through our Ministry of Higher and Tertiary Education, Science and Technology Development to say, look, let's, have this additional, impact of education, innovations which are there in universities, they should lead to industrialization. I think it's important for people to understand that in all countries which are developed countries in this world, they look at their, higher education institutions, especially universities and other research centers, for solutions to problems which they face. For Zimbabwe now, it was realized that there was a lot of, research taking place. That research was ending up in bookshelves or in some, storage places without being applied to solve some of the challenges which we have. So when we talk of innovation hubs, we are talking of, places where this, research is then assessed and then, converted into, products and services and processes as well. So As NUST, we are grateful that we are one of the 6 universities which were identified by the government to have an innovation hub. And this innovation hub is crucial in terms of saying, as a science technology institution, we should be able to identify and come up with the solutions to the problems or the challenges which are faced by the society out there. Even industry, we need to collaborate with industry. Education 5.0 is anchored on innovation leading to industrialization. So without, industrialization, we will always be a consumer economy where we will be importing simple things. I want to give a very crude example. We are importing toothpicks in Zimbabwe. It's not that we don't have the capacity to do that. We should be able to do a lot of import substitution by coming up with products and services which we can actually, commercialize. The sanitizers which we talk about, if I'm not wrong, they used to be imported, but right now they are being made locally, and they've been made much cheaper than what was being, imported. Import substitution will only happen in Zimbabwe if we capacitate our research and development so that it can lead to industrialization. Because education 5.0, we need to avoid again reinventing the wheel. When I say reinventing the wheel, there are a lot of solutions to most of the challenges which we face as Zimbabwe and as many other developing countries. But the challenge is, what are we doing in order to try and say, look, how do we get even those solutions here in Zimbabwe? To say we can adapt this solution. There's a health crisis in terms of, I'll give an example again, cholera, for example. Cholera was long, a vaccine for cholera was long found. But you find that, killing people, not only in Zimbabwe, but in many other parts of the developing world. But there's a health solution to that. We need to bring it to Zimbabwe, make sure that we do have these vaccines produced even locally here. So I'm looking forward to. Thank you very much.
Thank you, Baba Ncube. I can see you're all fired up when you talk about those innovations you are going to bring. And we are going to be keeping a tab on NUST to make sure that we make sure those products are locally produced. I want to go over to Professor Shabanga. The most topical issue worldwide, and indeed in Zimbabwe, is the issue of vaccines. Please unmute. As NUST, are you positioning yourselves to get into this bandwagon and be leaders? We've heard from Mr. Dlamini how he's positioning in terms of test kits. We don't want to be testing and discovering positive people, COVID positive, and yet we can reduce the number of positives through vaccine. What is NUST doing? Any thoughts on that?
Thank you very much for that question, ma'am. It is one of the questions that troubles me day and night. To say in Zimbabwe, we are very much educated. It doesn't surprise me to say we've got a scholar from the University of Birmingham. They are a Zimbabwean. They are part of the development of the vaccine. It doesn't surprise me. We've got all the knowledge. But the problem now, when it comes to innovation and development in our own country, we lack. So now, as the director of research and internationalization, it has been my wish to say, as NUST, why can't we come in and form interdisciplinary groups? And that is what we have started doing. We used to have this, but now we are saying, let's come up with groups that will obviously effectively tackle some of these issues that are coming at a go. So we are trying to establish groups, let's say interdisciplinary, meaning that I am able to go and get an engineer, I'm able to go and get Mr. Dlamini, I'm able to go and get someone from applied sciences. These people are able to sit and we request some funds from the government that will obviously help us to study the vaccines that are available, or to study the way the vaccines have been developed. And then at the same time, we can come up with our own vaccine. A simple example that we obviously came up with was the issue of ventilators. I think with the ventilators, NUST did well. We had some ventilators that had been lying idly in some of the hospitals in Bulawayo. we dispatched a team of engineers, a team of interdisciplinary research to go and look at those ventilators. They were able to fix some of the ventilators. But now the problem came in when we had the issue of funds, to say, in order for us to, as researchers, in order for us to come up with a new developed ventilator, we need the basics. For any research, for me to research and develop a ventilator, I need a basic to say, what are ventilators? Who has done this kind of ventilator, of which we had those old ventilators. Some of them we couldn't fix. We could study them and then see how we can improve and then come up with an effective ventilator, of which we hit a brick wall because we could not get some of the funds to support that initiative. So
isn't this an opportunity to call for partnerships? Surely there would be industry that's willing to partner. This is a people's movement. This is a fight against a pandemic where all hands are required on deck. What would be your call to action for potential funders? What do you need at the moment?
Okay, thank you very much for that question, Prof. I think it depends on the projects that we are obviously handling, because at the moment, we would obviously love to go back to that project because the researchers were eager to obviously do that particular project. So what we obviously need is, number one, funding for some of the gadgets that they obviously needed to improve the ventilators. And then number two, obviously, we'll need some collaborations with some industries out there to say, we present our case and then they tell us their experiences. And therefore, when we combine such experiences, we obviously come up with the new improved products of high efficiency.
So what sort of stakeholders are you looking for? This is your opportunity to make the clarion call. Who do you need around the table, around your office for you to do business effectively?
Okay, obviously, I would need some companies to come in. Obviously, if we could get some companies, big corporates that can come in to help. For example, companies like the mining giants companies.
Call them out. They are listening to you.
Okay, obviously, companies like Mimosa, companies like Howmine, companies like Delta, companies like Old Mutual. These are some of the companies that are able to do corporate social responsibility. As they come in, we are able to work, and at the end of the day, the nation develop as a whole. I'm clear to say at one point in time at NUST, we were able to manufacture sanitizers for free for some of these companies to say, you've got a community around that is supporting you. So why can't we do that such that we establish that relationship amongst us? So I believe once those corporates come in and with the government included, we can come in as an institution, good research, collaborations, and obviously we'll do well.
Thank you, Professor Shabangane. What is clear is that there is shared value. Any stakeholder who partners with you will get something whilst you also get something. So it's important to map out those partnerships, identify what's in it for them. As you say, you can go into an arrangement where you prepare PPEs for their staff for free, but they're giving bigger for the wider community. And thank you so much for that. Let me go to Mr. Dlamini. You are the man in the deep end of testing. You own a machine, you've given it to Mpilo, you've put it in a biosecure place, you are looking at the media for transporting viruses. Can you unpack for our audience, what's the difference between PCR test and the DNA test? I mean, there was a lot of controversy on which test did you do. This is a good opportunity for us to get a feel of what a positive and a negative means, since the new thing is to be positive and negative. What are the different test facilities and how do we interpret them?
Okay, right. There are basically three types of tests that we use for COVID. You have what we call the antibody test. The antibody test, that's the rapid test, which you get a drop of blood onto a cartridge and then put some liquid, and then the blood moves what happens there is that we'll be looking for antibodies. These are proteins that your body makes in response to an infection by the virus. So when those proteins are detected now, then we say you are positive. It's either you are still positive or it shows you were once exposed, got infected, and you have healed, and now you have the soldiers protecting you. The antibodies are the soldiers, so to speak, that protect you from infection. Then there is the antigen test. The antigen test now is still looking for protein. It's a rapid test, but now it is no longer looking for the protein that your body has produced. It is looking for the protein of the virus. Okay, you see, we all know the structure of the virus, the COVID virus, with those spikes, yeah, which look like jewels on a crown. Those are proteins. So the test will be looking for one of those proteins. So it's also a rapid test. Then the PCR now looks for the genetic material of the virus. It looks for the RNA of the virus or the DNA of the virus, if you allow me to use that expression. So from one copy, even if you have one copy of the virus in a ml of blood or in a ml of your nasal swab material, PCR, the polymerase chain reaction will multiply that 1 billion times within an hour so that it becomes easily detectable. So that's how these tests work. So the problem with the antibody tests is that you may not be able to pick the virus or the antibodies within a certain number of days.
Mm-hmm.
So, and also the PCR, whereas the PCR can pick the virus much earlier, because even if there is still very little of it, the PCR by its nature will multiply it and then view it. Yeah. And then as the virus progresses in its life cycle, which is about 28 days in your system, towards the end of that time, PCR may fail to pick the virus, even if you were infected, because the body would have devised methods of getting rid of it.
I really like the way you have unpacked it. Let me just zero in on the PCR. You have portrayed a picture of a curve whereby there is a window period where, as scientists, you're very comfortable. If I come today for a test after X days of exposure, you're bound to catch a positive if I've been exposed and infected. Then there's a dead part where I'm on the full recovery, the virus is almost out of the body. What would you say from your experience of the millions of tests or thousands you've done would be the best time in the window if I suspect I've been exposed to go for a test? Because my worry is if I test on day 0 when I met somebody who did not declare positive and I was exposed, if I go and test after an hour, from what you've said, chances are I'll be negative. What would be the best time for me to go in for a PCR test?
I think after 3 days.
After 3 days,
yeah,
you can magnify the virus and see it after 3 days of exposure.
Yeah.
Thank you. That's deep science. Can I go personal with you? Have you, after touching all these thousands of samples, been exposed personally?
Yes, obviously, by the nature of our work, we were exposed. I'm a first wave COVID-19 veteran.
Congratulations, we still have you standing. We thank God
yes,
for that.
I got infected with COVID in July last year. It was a grueling 2-week of isolation. And I remember I had someone that I was close to had passed on, and it was due to COVID. So I went back to work because at work we're interacting so much. And there were 34 of us. I said, everybody will get tested today. And we did. And we did the test around 10 in the morning. By 4 p.m., the results were ready. I was the only one positive. And the positive was so screaming, it was more positive than the positive control. But I didn't develop any symptoms. I was lucky. Wow. Then I organized, contact tracing. All my family were tested the following day. And lucky enough, I had not spread it to them. Yeah. But even if you don't have symptoms, it was stressful because you'll be thinking maybe the lungs will collapse tomorrow. Or maybe the following day I'll get breathing difficulties and so on. But look, I was fortunate I didn't get all those complications. And did the test again after 14 days, and I was negative.
Mr. Dlamini, on that positive, sad but double positive and exciting note, we celebrate your life. We celebrate the work you do in helping us with the testing. We celebrate the commitment that even despite all that, you've gone back to duty, and we need more of these stories. They give us hope that as we share, you can come out of the dark and be in the light and celebrate life. Sure. Professor Hlabangana, Mr. Ncube, I want to give you each just 30 seconds for you to just say, if you were to point a placard, a banner that you are allowed to display, what would be your clarion call? What 3 key words would you want to say, or just a short sentence on a billboard about your experience in the forefront of fighting COVID-19? I'll start with you, Ncube.
Okay, thank you very much, Prof. The advent of COVID is actually taught us as NUST Innovation Hub to actually move out and say much of the technologies which
30 seconds.
Much of the technology that Zimbabwe needs, or solutions which it needs to some of its challenges, are in widespread use elsewhere. What we need as Zimbabwean researchers is to exploit these technology transfer opportunities.
Thank you.
To build capacity to find, absorb, and use these technologies.
Thank you. Thanks. Professor Hlabangana, 15 seconds.
Thank you very much. What I'll obviously say is fine, the COVID, the vaccine is around, but now as a university, we need to continue researching, coming up with more efficient ways of protecting the community. And to the community, stay positive. COVID is real. Even though the vaccine is there, it can still catch up with you. Stay safe.
Thank you. Mr. Dlamini, last word from you.
Yes, let's continue working hard, adapt and adopt technologies to protect ourselves from this pandemic, and even those that are in the pipeline. We're living in difficult times.
Thank you so much to the NUST community. Congratulations, NUST. You were in the forefront of testing as from April last year. You produced PPEs that are SAZ certified. You went out to industry to try and repair the ventilators. You are now moving forward into the vaccine development arena. You are also into PCR testing kits. You are also looking at media for transporting the viruses. And you are getting a new machine that will put you in the forefront to not only do business, but help Zimbabwe to be able to combat its problems. Thank you, NUST. Keep shining and think in other terms. On behalf of I Am for Bulawayo Fighting COVID-19, We are proud to have you located in Bulawayo, but serving the whole nation and the world. Thank you.
Thank you.
Thank you.